welcome back, our viewers. As we had mentioned, we are going to go to the treatment of COVID. But just before we go there, we need to mention about the isolation and what the perspective of isolation is now that things have changed. Sami will continue as where he had left concerning the changes that the government has made.
Thank you, Dr. Sylvia. It's true. There has been evolution of the measures in quarantine and isolation facilities. And this, as at now, what happened is the government literally introduced a home-based isolation protocol.
Okay.
This is to involve the community in participation of infection prevention and control of COVID-19. And these protocols were introduced in June, actually in the June edition of MOH, where they came up, the government came up with the home-based isolation, dubbed Jitenge.
Okay.
And this helped a lot to decongest the facilities and also involve the community in management of COVID-19 disease. So it progressed from facility level to home-based level. The people in the community, when they identified that they have probably been exposed to or closer to someone who was positive, either a relative or a friend, they were advised to quarantine themselves at home, observing the symptoms.
Yes.
And if someone was asymptomatic and they had tested positive, initially there were isolation facilities, but now they are advised to isolate at home. That is self-isolation at home.
So what brought the changes? Is it that the numbers went so high that there was no bed capacity? Or
actually, Doc, what happened is the change came in when the government realized there was community spread of the disease.
Okay.
And the community spread really called for community participation.
Okay.
That is one of it. And also protection of our health facility systems.
Okay.
Not to overstretch them, not to overwhelm them.
Okay.
Unnecessarily, by holding people who can be managed at home.
Okay.
So that really worked in those areas. And as of now, we had seen the cases come down through that home-based initiative and self-isolation, self-quarantine at home. We saw the cases come down completely with community being able to manage stigmatization issue, which was a big issue by then. But when they realized that this thing is with us, it's at home, it's within the neighborhood. I mean, the mentality of the community changed. And they were able to put on masks without being followed up and all that. Now, at that point where we saw the cases come down, it was kind of a success until now, when we see now a resurgence of cases which we are now experiencing. Yes.
But I think one beautiful thing with the home isolation is that it has removed that stigma that used to be associated with, if you're COVID positive, you have to be taken to a government facility.
Absolutely.
So at least when you know if you have, that would be now for the very asymptomatic or the mild cases only.
Yes.
But for the moderate to severe, they'll have to be in the hospital.
Yes.
Okay, thank you so much.
Awesome.
So I'd just like for our viewers to understand, in case somebody is feeling sick, maybe they have symptoms of COVID, they have cough, they have fever, they have the loss of smell, they're feeling tired, the malaise we're talking about. How would you advise them, Mr. Onesmus? Now that you know there's home-based isolation, you can go to a hospital facility, what would be the best advice you'd give to our viewers?
Thank you so much, Dr. Terry, for that. Maybe what I would just begin by saying is that it is also important to understand, as we talk about COVID-19 and being a respiratory problem, respiratory disease, affecting, the respiratory system. And of course, studies have also shown that it affects other body systems, or other body organs. It's important to appreciate the fact that it's not every time someone has respiratory system complaints or problems, it does not necessarily mean that is COVID. And therefore, one of the things to understand is to not label every respiratory system complaint as COVID.
True.
Needless to say, all these diseases require that we have approaches, and that we have treatment and the appropriate diagnosis and management done, of course, to be able to avert morbidities and mortalities that come from these particular problems. But if I may just answer your question, try to simplify it, is that if someone feels sick, one of the things that came out during the early days, there were numbers that were really provided, and out there in the community, a number that you could call, and service would be provided, and someone would easily be picked up from their house and be taken to the facility. Things have evolved over time. And what I would say is that one of the things one can do is to make sure that they, number one, adhere to the MOH or WHO protocols. And one of the things is the wearing of masks, proper wearing of masks, especially the approved mask. I know that that's still a question about approved and which ones are not approved, and which ones protect against the virus and against the bacteria. But the masks of different type, the K95, the K95, the 3-ply, and these are the kind of things, or the kind of masks, first of all, we need to to be in possession with and wearing them appropriately. Maybe you could explain to our viewers, when would it be necessary to wear? Because I feel like if somebody has the symptoms, which could be related with COVID, it would be very important for them maybe not to wear a fabric mask, and to just ensure they're wearing a surgical mask, because that one has been proven to protect even the people who are around. Absolutely. And this is what we are saying. Let's negate a little bit from the fabric mask into the surgical mask, the K95 to the K95 to the K95 masks, as we proceed to the hospital for appropriate diagnosis and management of this particular problem. And of course, things like sanitizing, hand washing, avoiding touching surfaces, along the way, where that is possible and practical, to be able to get the appropriate help in a hospital setup. If it is okay and if it works, it's okay to make a prior call that I'm coming. You can call a hospital if that's possible, that's practical, that I'm coming and I feel this way and the other symptoms like this, so that would be very important. Yes, so that the healthcare workers that we have in the facilities and in the hospital, or they are always ready for any type of patient. But you can be able to create awareness, because they are also human beings. We know we have had healthcare workers affected by this disease, by COVID-19. So we can be able to protect and prevent as many and their families, the better. So we can make that small effort of just making a call, so that they are also ready for for you. It's better to prepare for the worst and just fight. It was just simple thing than not just be prepared. And again, I think if you call the hospital facility, they can even put you in a different isolation room, as opposed to keeping you in the waiting area. Absolutely. With the rest of the other patients. Absolutely. So you really reduce the risk of transmission. It reduces the risk of transmission, and also the adherence to these WHO guidelines about social distancing, keeping a 1.5 meter distance and all that. We are empowering, and we're also going to help others, so in terms of prevent. Because remember, the moment we're seeking health in a health facility, doesn't mean that every other person there has the same disease. So we need to protect each other, from this. So our viewers, one of the things that you need to do is that you need to seek help, you need to seek health advice, and don't judge and condemn yourself. That's not right. Something else that also needs to be done. If that takes a longer duration of time, probably to be able to access healthcare, or to be able to access help, from a facility, whether government or private facility, it's important, individually, to first of all, quarantine ourselves. We have families, we have children, and we have elder people or younger people. If it's within a day or two, and then you're able to access healthcare, it's also prudent to quarantine ourselves and to be able to minimize contact with household contacts. If it is work-related contact, so that we can also abate and be able to cut off, the spread of the disease. And I also feel it's important, if somebody is able to get a test done, that would be the surest way to know whether it's COVID. Because as you said, not all respiratory problems are equal to COVID. So if possible, if somebody can be tested, maybe they're just having pneumonia or another condition. So that's very important. But maybe you could also tell our viewers, so if somebody goes to hospital, what kind of treatments are available for somebody who could be COVID positive? At that point, we just agreeing that we have made the diagnosis, and the appropriate tests have been done, to be able to diagnose COVID, and probably even other diseases which could be concurrent with COVID-19, because we have seen that some patients or some people have had concurrent diseases or comorbidities.
Yes.
So that has already been done, and the other diseases are also being taken care of. So now we have, COVID-19, and we have already made a diagnosis. As we said earlier in the show, some of these lie in different categories or different classes, that is the patients. We have those that are, asymptomatic, and probably the asymptomatic will just be diagnoses that are made by those who came in, either from, there are several sources you can be able to make that diagnosis. They came in for other problems and decided to test COVID. And number two is that they were actually from the community, and they have been taken on as contacts, and therefore they have been diagnosed. So they don't have any symptoms that regard to COVID, so asymptomatic patients. So as you manage any other current disease appropriately, as they're supposed to, and then these patients are supposed to be quarantined, because asymptomatic patients also have the capacity of shedding the virus.
Yes.
Shedding the virus, I think we talked, the modes of spread, earlier on in the show. So they have the capacity to spread the virus. So we need to advise them to quarantine. We also need to have them basically quarantine, and also so that you can prevent contact and spread. Number two, we also have those that have mild symptoms, and probably these have cough, they're sneezing, some low-grade fever here, there. They are not very sick patients, they are stable patients. COVID-19 being a viral disease, one of the challenges that have gone along with it, over the last several months, well, less than a year since, it was announced as a global pandemic, is that being a viral disease, there's still ongoing research about the treatment, specific treatment for this virus. So a lot of the patients that have been having mild, moderate symptoms will just require symptomatic treatment, a symptomatic approach. Whatever symptoms that is really troublesome to the patient, if it's fever, you can use medicine to be able to lower that, analgesics, antipyretics, that is. If they have a cough and they're disturbing, you can also address that. But on patients that are going to be, very critically ill, moderately, and they need hospital-based care, because some of them are unstable. They need to be managed in the ward, and they need to be observed. Again, those ones require that you also manage them a little bit differently. Some of them may require that their metabolic factors and functions also be checked over time, and be able to make sure that they're actually stable and they are not complicating. Those are very severe disease, that they will require even ventilatory support, and they require high dependent unit support. Very critical patients, and intensive care, patients. As we move along with, the research and with the advent of medicine, one of the drugs that has been developed and been FDA approved is remdesivir, and can actually be used, has actually been used for these patients that are critically ill. And of course, this is now, we are not saying, from the show here that you look for the drug, begin to use and all that, and buy these over the counter. No, that's
actually,
we are basically saying it's actually injectable, and it's a drug that is that is really controlled, and it's only on very reserved patients. So we are saying that those patients that are ICU, they require all the support. You require to keep their functions all right, and in a couple of days they basically also improve. And obviously after that, we need to have these patients, whether they are asymptomatic or mild or severe disease, they need to have repeat tests done. Because every time we talk about patients in terms of management, and talk of improvement, we have to look at what is the clinical improvement of these patients. What were they feeling in terms of the symptoms, and where are we now? What about their laboratory functions, where they were and where are we now? Where imaging is also relevant, we also look at that. So looking at that whole picture, the message is the test has to be repeated. The COVID-19 test has to be repeated, and we have to have tests that show that patients now has turned negative. They were positive, and now they're actually negative. Of course, in terms of treatment, we never leave treatment without talking about prevention. Indeed, treatment is only a part of prevention. It's actually a secondary level of prevention. So you have all this primary, secondary, and tertiary. So we always have to remember that you have to have these patients, advise them again that it's possible for someone to be reinfected with COVID again.
Yes.
Cases have been there
Yes.
that we had this particular person who was COVID positive, turned negative. Now they have reinfection. So we go back again to the late guidelines.
Yes.
The social distancing.
Yes.
We're talking about sanitizing. We're talking about wearing of our masks appropriately.
Yeah.
And I think that's
So the immunity is not lifelong.
The immunity,
Once somebody has COVID, immunity is not lifelong.
It does
Those
not.
antibodies will not protect them against that reinfection.
absolutely. It does not. COVID-19 does not confer a lifelong immunity.
Yes.
So it is possible for reinfection to occur.
Yes.
So again, that being part of primary prevention. Of course, secondary is the treatment part of it, and of course the tertiary prevention. You're talking about whatever complications
The
and whatever
rehabilitation.
morbidities that came out of that, where that is relevant because of probably other systems that could have been affected, should also be taken care of.
Okay,
Yes.
that's very, very good. So maybe let's just go back to you on that issue of the prevention. As you mentioned, maybe you could remind our viewers those precautions that we need to take care of, because I think our core message for today should actually be let people remember that COVID is still there and they should still protect themselves.
Sure.
Yeah.
Thank you, Doc. Viewers, remember we have COVID with us, and the most effective way of infection prevention that is available and effective, one is use your mask appropriately. Put on your mask appropriately. 2, social distance. And 3, wash your hands. Washing of hands every now and then, especially when you feel like you have touched some surfaces here and there. These 3 methods of IPC have been effective globally, and they're working. And we can control the virus, we can keep it out. Thank you.
Okay, thank you so much, Sami.
Asante.
Yeah, so there's a question that I wanted to tackle to our viewers. As the host, I'm going to ask myself a question because I'm a pediatrician in profession, and we just wanted to bring about the issue about COVID-19 in children. So do children really get infected by COVID? Yes, they do, but they tend to get milder infections compared to our adults. And we find that from the studies that have been done, only 80% of adults get asymptomatic COVID, whereas for children, about 95% of them get asymptomatic cases, and only 0.1% will get very severe or very critical illness. So for the children who are below 2 years, remember, we are not allowed to put the mask on for them because they're not able to remove the mask in case they feel like they're suffocating, unlike children who are above the age of 2 years. So don't put on a mask for a child who's below 2 years. And if you're a mother and you've just delivered a newborn and you've been tested positive for COVID, are you allowed to breastfeed your baby? Yes, you can breastfeed your baby because breast milk is not a risk of transmission for COVID-19. What passes through breast milk are just the fragments of COVID, not the live or the viable virus. And therefore, what that mother needs to do is to ensure they are wearing a mask, because they cannot obviously maintain the social distance between them and the baby. And they also need to perform hand hygiene whenever they are dealing with their baby so that they prevent contamination of the baby's face or the mucosa of the nose and all that. So lastly, we're going to tackle one more question from Sami, who's going to handle the issue of statistics. What do you think are the statistics for COVID-19?
Thank you, Doc.
Yeah.
That reminds me one thing.
Yes.
When I was responding to some patients who
Yes.
had COVID,
Yeah.
they really wondered why they didn't feel the symptoms.
Yeah.
And we were telling them they are infected.
Yeah.
We had really to work hard and tell them, explain to them that they were infected, but they didn't elicit symptoms, and they could really transmit the disease.
Yeah.
Actually, they are called the super spreaders of the
Yes.
COVID-19. That's the
Unfortunately.
right word for them.
Yeah.
So actually, the statistics, kindly viewers, these are real numbers.
Okay.
Globally, even to the local statistic that we have. Like in Kenya, as of today, we have 49,997 cases as of yesterday's statistics, with about 920 deaths. And also talking about 34,000 plus recovered, and we have an active cases of above 14,000, around 14,000. So these numbers, we get them from the laboratories. These are approved numbers by Ministry of Health after true testings that have been approved by MOH. About testing, 1 minute, Doc.
Yeah, please mention.
On this, like Ministry of Health had the first approach of testing the target groups. That is, the people who are isolated, who are in quarantine.
Yes.
Let alone when there was need to test whether the population had the infection, the community had the infection, the MOH moved to mass testing. And mass testing, remember, by that time you could test big numbers of volunteers in isolated areas. Later on, they changed to targeted testing. And now that's where we still are, on targeted testing. Targeted means that we are looking at the hotspots of possible infection, and that's where the samples are collected. And these are...
What are some of the hotspots?
Actually, the hotspots initially, they have been evolving on and off. Initially, we had Nairobi County and Mombasa County, and they were under lockdown. And after the COVID-19 infection spread to the counties, actually MOH give and advise the counties to take over management of quarantine and isolation facilities from now the county level. And that has been happening. Now the counties have been running the isolation and quarantine and also mapping out the spread of the infections. So they are doing well on that, and MOH is really hands-on. They are really working around it, and also that's why we have this data. This data, which is true data and real-time data. Okay.
So maybe you mentioned that there's a resurgence. Do you think it's related to schools reopening, or what could be causing this? Is it the complacency?
Absolutely, Doc. I think because many schools have not opened yet. They are still trying to implement the guidance of the Ministry of Education and MOH to prepare to reopen. So many of the students are actually at home. And the reason why I think we have this resurgence most likely is because of the complacency terms, and also the loosening of control measures that we had by the government. Now people can move freely, people can meet anyhowly. They are not very strict on observing infection prevention. And also, as Mr. Onesmus talked about, how people have changed to live with COVID and to do their normal businesses with COVID with no much concern of the infection. That one has really contributed to resurgence. And if you look to other nations outside, they're still struggling with this problem of the second wave kind of, and the health system being stretched to some level. And how we pray that we'll come to a point that we will be able to control this disease within our borders.
So the most important thing is to try to flatten the curve so that we don't overwhelm our health facilities.
Absolutely. There will be a problem when we really overwhelm our healthcare system. Because all other necessary hospital ailments kinda will be not being attended when they should be. And most likely the attention may shift to COVID disease, and also the burden of it, the complication of it, the infections spreading fast, and both within the facility and outside the facility, that would be a little problem. But when we take personal responsibility as Kenyans, observe the guidance we have, infection prevention measures, that one we can really tackle with the problem that we're grappling with.
That's very true. Maybe I see you have a mask. Would you mind maybe demonstrating to the viewers how they need to wear the mask?
Sure. Thank you.
And the mistakes they've been performing.
Thank you, Doc. This is a surgical mask, face mask. We have different types. This is one of the common ones and simple masks that are very effective in control of COVID-19 infection. For the N95, You know that you hold it from back and you pull up the straps at the back of your head. And now for this face mask, what you do is it has two sides. This could be probably more colored than the inner side. Naturally, the inner side is the less colored one, which you place next to your face and mouth. Make sure you cover well your face, that is from your nose and your mouth, and hang the straps behind your ears. Then you need to make sure it fits well at the level above your nose, at the bridge of your nose, and below the chin. By this way, you are safer from getting infected, and you, if you're infected, from infecting the other person. Simple way, which is very effective.
Thank you so much. Thank you so much, Mr. Sam.
You're
a very good educator. So let us have our parting shot.
Wow, thank you very much. I think viewers, let me put it this way, maybe in two ways. One, like we said somewhere in the show, that some laxity has come over, in dealing with COVID-19. I would say one thing. When we started on, these measures in March 12th, thereabout, and the Ministry of Health, released guidelines for us to be able to follow, certain other things also happened, because of people doing, hand washing and doing, wearing of masks and social distancing. Other, infections or other problems really reduced. Already there is some anecdotal, information that shows that even diseases spread, fecal-oral, like diarrheal diseases, really came down, and their numbers dropped because people were really washing their hands and maintaining a lot of hygiene. So these things came as a result of COVID, but they also worked some good for us. That social distancing, that wearing of masks and the like, they also did some good for us. So what I would say is, let's not negate this idea of, practicing these measures, because they are protecting and they are preventing the spread of the disease, and they are also helping us in reduction of other, diseases or other health problems, infectious diseases that are spread through other means, like we say, fecal-oral transmission of diseases. So COVID-19 is still present with us. It is still here with us. We are not yet been declared free. We look forward for the best, but as it were right now, let's practice the measures. And the other thing I would also say is, let's have hope. Our hope cannot be cut off. We have come from far. Unfortunately, globally, we have lost some people and some lives. And even in the nation, some lives have also been lost. But let's have hope. The battle still continues. The fight still continues, and we will ultimately come out of this, victorious. We always believe, and we have hope in our God, who is able to, bring us and be able to see light at the end of the tunnel. So our viewers, even if you're there, you've been affected and infected by COVID, just have hope. It is going to be well.
Yes. Okay. Thank you. So viewers, we're really grateful that you stayed on with us until the end. What we leave with us is that let's still take care of the standard precautions. And I'll leave us with this verse from Exodus chapter 15, verse 26, that says, I will put none of the diseases on you that I put on the Egyptians, for I am the Lord your healer. So we want to leave you with that word of encouragement that you're protected, and we are going to have a word of prayer by Mr. Onesmus, even as we close the show.
All right. Our Lord Jesus, we thank you. Thank you for this opportunity and this moment that you've had to discuss matters COVID-19. We thank you because of the knowledge and of the empowerment, enhancing the health, even of our viewers and our friends, to the glory and honor of your name. We bless you and we love you. Give us, Lord, days that are prosperous and that are victorious ahead. In Jesus' name we pray and believe.
Amen.
Amen.
So God bless you. We see you next time. I was your host, Dr. Sylvia Mwathi. Good night.